If you want to understand today's session, you need to watch the following videos before watching today's video. Why means today's video is completely based on these two videos which I am going to show you now. So first video is meet concept. So basically in HCC coding, meet concept is the most important concept we need to follow while coding HCC coding live charts. So this video consists of 17 minutes approximately. So which consists of all the guidelines and basics related to meet concept. One more important topic for HCC coders is tamper concept. If you don't know tamper concept, watch this video which is already published on fastcoder 21. If you know meet concept and tamper concept, you can code any HCC coding live chat without any error. So after watching those two videos, watch this video so that you can understand very easily. So what is our topic today? Simplified HCC coding guidelines. So after watching this video, you will be comfortable to code HCC coding charts in easy way. So we have first scenario, chronic CHF noted and patient is on Lasix. How do we code this scenario? So in order to code this scenario, we need to check the meet concept. As I have discussed previously, watch meet concept video first, then watch the scenarios. So here our question is, can we code CHF here? Yes, here we will code CHF. So CH means congestive heart failure. So here physician is treating the patient with Lasix. So here basically physician is providing the treatment for CHF. So here we can code chronic CHF as a HCC diagnosis. Next scenario, patient has history of stroke, no deficits, means based on previous stroke or there are no sequelae related to stroke. So that's why they have mentioned here no deficits. So can we code here history of stroke? So you can code or not based on client guidelines, but if you code Z86.73 but it does not have any risk adjustment value or you are not going to have any type of risk adjustment factor, usually we call it as RAF. Next scenario, provider is assessing patient post CVA with deficits. So patient is having previous cerebrovascular accident. Because of that previous accident, patient is having deficits now. So can we code this scenario or not? So here we will code sequela post CVA. So using I69.X series for sequela stroke. Why means here physician is assessing the patient. So assessing comes under assessment of the meet concept. Next scenario, I63.9 listed on problem list from previous year or prior year. Can we code I63.9 or not? So here we will not code I63.9 as I63.9 is an acute code. So only valid if stroke is current. So if the stroke is current, we can code. Otherwise, we can't code acute codes in HCC coding. So next scenario, patient has CKD and labs reviewed. Can we code CKD or not? So here we can code CKD. So what is CKD here? Chronic kidney disease. Okay. So here we will code CKD. Why means providing is here patient has assessed patient CKD using labs. So based on meet concept, we can code CKD as a chronic conditions. Okay. So what is next scenario? So diabetes listed, patient is not evaluated or treated. Can we code this scenario or not? Or can we code diabetes or not? So here we can't code diabetes. Okay. So this only listed, so we can't code. So patient needs to do something related to diabetes. Even patient needs to perform any labs related to diabetes or patient needs to monitor diabetes whether it is in the control or uncontrolled or patient needs to provide any medication adjustment. So those are scenarios related to meet concept. So here we can't code, just diabetes listed, physician is not doing anything related to diabetes. Okay. So we have next scenario, MI occurred 2 years ago, now asymptomatic. So what is asymptomatic? Patient is not having any symptoms now. So basically this is a history code. Can we code MI here? So here we can use I25.2 only if linked and managed. I21/I22 only if acute. Okay, acute conditions means those are the current conditions basically. So here patient is having MI occurred 2 years ago. Okay. So if the physician evaluates and if anything related to this physician performs using the medications, or if the physician manages only, we need to code MI in HCC coding. Next scenario, morbid obesity documented but not addressed. How do we code this scenario? Can we code morbid obesity or not? Okay, so basically for morbid obesity, ICD-10 CM code is E66.01. So based on 2025 HCC coding guidelines, morbid obesity does not comes under HCC code. And also here meat is missing. Only morbid obesity is documented. Patient is not doing anything related to morbid obesity. So here we can't code morbid obesity. And if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG coding training, SCC coding training, CCS certification training, please send WhatsApp message to 707-526-3939. And also if you like this session so far, please click on like button to motivate me to provide more valuable videos. And also if you like this session, YouTube will send these videos to other coders who are planning to enter into medical coding. Next scenario, in the documentation you will see insulin only. So no diabetes is mentioned. How do we code this scenario? Can we code insulin here? No, we can't code insulin for Z79.4. Why means Z79.4 does not risk adjust. If the patient is having diabetes code, this might be risk adjustable. So here Z79.4 is does not risk adjust. Okay. Next scenario, COPD managed with inhaler. So can we code COPD here? Yes, of course we can code COPD. Why means physician is managing patient COPD using inhaler. So it will comes under treatment of the meat concept. And also this COPD maps to HCC 111 with treatment. Okay. Next scenario, patient with ESRD and dialysis. Can we code ESRD and dialysis? Yes, we can code. Why means N186 point is risk adjusting and chronic with meat. So basically N186 is risk adjustable ICD-10 CM diagnosis code, and also we can use this N18.6 using the meat concept. Okay, as physician is providing dialysis support. Next scenario, for example, in the documentation, if we see history of cancer, but there is no treatment towards that cancer. So can we code history of cancer or not? Okay, only Z85.X for history. As if you code also this Z85 series is does not risk adjust double code. Next scenario, for example, in the documentation, if we see cancer in remission and follow up, can we code cancer in remission or not? Yes, you can code cancer in remission, as remission is not synonymous to resolved. So remission means still patient is having the cancer. So here you can code C code using the current cancer. Okay. If the patient does not have any cancer, you can code Z85. Anyway, Z85 series is not risk adjustable. Whenever you want to code C code, you need to check the documentation, whether patient is providing any treatment or patient is managing the patient's cancer using any type of medications. Okay team, thanks for watching this video. If anyone looking for surgery, IPDRG, HCC, CCC trainings, please contact 707-526-3939. If you like this session, please click on like button.